Okay, so warm welcome to everybody joining us today for our 8th annual ISNTD Bites meeting. We're covering vector control and disease surveillance. I'm saying a warm welcome. It's quite a chilly morning here in end of October in London, but delighted to be here to kick things off today. It's been a year of adaptation, a year and a half of adaptation. I doubt very much if back in 2017, when the WHO put forward their global vector control response strategy guidelines to 2030, anybody would have anticipated the year and a half that we've all been through in terms of the headwinds faced by the global COVID situation and response. What's pretty obvious in all of that, and I'm quite sad, it's really going to be the most vulnerable and the most poorest populations globally that are going to suffer in terms of the impact from COVID-19, whether that's due to a lack of access to the available vaccines, or it's indeed an impact of the isolation measures that have been rightfully put in place in terms of trying to combat the spread of COVID-19. Those isolation measures having a massive effect on the kind of, how to put it, socioeconomic effect, mental health effects on very, very fragile economies based upon, on the ground, very fragile forms of livelihood. I'm very sad to say that. However, there is an upside in a strange way in that the vector control communities really come to light, the importance of the vector control community and the activities around that against the COVID-19 backdrop. What I mean by that is that those vulnerable and poor populations, those communities, they are at threat from vector-borne diseases, and we're really, what the adaptation that we're talking about is trying to adapt the vector control response to make sure that those threats to those communities by vector-borne diseases such as dengue, chikungunya, malaria, all of the vector-borne diseases, are not taken off kilter, and so that at least that threat is managed in an adequate manner. So it's been a year and a half of adaptation, and that theme's running all the way through today's kind of meeting. We've got sessions. We'll be kicking off shortly, after this introduction, with COVID-19 and vector control. We've got sessions looking at disease surveillance and how that relates to changes in vector control policy, some of the tech involved in that. We're looking at urbanization, the built environment as perhaps a touchstone where people can kind of pull together multi-sectorial kind of approaches on that and combat the threat of VBDs, of vector-borne diseases. Insecticide resistance, we're covering that in a session later today. There's a very exciting session at the end looking at leveraging communities for vector control. We've got a packed day ahead of us, and I just wanted to kind of have a brief kind of introduction to the day. In terms of the audience, we said welcome. Would be really, really useful and helpful if in the chat function there that you've got, if you could just give us a quick hello. We're seeing some hellos coming through. Monica Hernandez Estrada, everybody. Almanesh Halimariam saying hi from Ethiopia, an entomologist from Ethiopia. If you could, Sonalika Mahajan from India, a virologist. We're trying to pull in, we've got northeast, southwest coverage in terms of the speakers and the audience. So please, if you give your name, your affiliation, your organization or academic affiliation and country, that would be excellent and very much appreciated. There will be a Q&A after the presentations, and we heartily encourage all of the audience to kind of get stuck in. It's about the community, so we just want some engagement and getting people to come together in the Q&As as well. I think that's more than enough from me. This particular session is going to actually tackle the adaptation or vector control in light of COVID. and the issues around that. We're joined by somebody who I don't think the vector control world per se would need much of an introduction, but I'm going to give one anyway. It's Dr. Raman Velayudhan. He's the head of vector control at a unit called the Veterinary Public Health and Environment Unit at the Department of Control of Neglected Tropical Diseases at the World Health Organization in Geneva. We're honored. Raman, Dr. Raman, you've always supported this particular this Bites event. It's 8 years now since we've been doing this, and we're very honored to have you here. And so I think that's enough from me. We have another speaker of this, which I'll introduce after, but we're very honored to have you on board. I think I'll pass the floor over to you. And if I could ask, I mean, we have two speakers in the session, and the other speaker is Dr. Frederik Seelig, who I'm delighted to welcome to today, because he's also on our dengue advisory group. He's the head of partnerships for the Global Vector Hub, an amazing open access kind of platform community tool for vector control, R&D and information around that, intelligence around that. We'll come to that in a second, but hi there, Frederik, as well. I think that's enough from me, and so I think we'll pass over to Raman. So Raman, over to you.
Thank you very much, Cameron. Thank you for you and ISNTD for giving this opportunity. It is really a pleasure always to talk to you and the group. So let me start the presentation of today. So basically, what I'm going to cover today is the issue of COVID and the impact on global vector control strategies. And I am mainly focusing on the neglected tropical diseases, which is, though I will be briefly touching on malaria, but other than that, all the other diseases are within the NTD portfolio. As you can see, we have about 9 the vector-borne diseases in NTDs, and we will briefly touch on this as we move forward. So in terms of NTD and COVID, there has been significant impact. The programs are highly vulnerable, and they get deprioritized, defunded, and relegated during a pandemic, and it has happened in several countries. Most of our program staff have been deployed for COVID duties. In some instances, programs were suspended and resources had been reallocated. So these are issues which we are facing at country level, and rightly so, because we are in the midst of a pandemic, but it really affects our routine program. So the biggest disruption of all was on community-based interventions, including access to diagnosis, treatment, delay in achieving the goals and targets for elimination. All those are part of the challenges we face in NTD. We did a recent survey. Actually, I wanted to put that survey results here. The recent survey really showed, a global survey of all programs showed that 44% of the countries have said NTD services have been disrupted. And we are actually ranked second to mental health and other neurological disorders, which are also, which got the first place, where they have about 50% plus. So we are 44% of the countries NTD services have been disrupted due to COVID. So we are working at this time, continuing to work during this COVID time. So what are we doing? Basically, here we are providing most of the normative responses, preparing country-specific key documents, target product profiles for certain key interventions, revision of guidelines are going on. We have a 3-level harmonization in place, and then we also tailor-make programs for countries, basically, to do webinars. We also provide leadership where there is deployment of staff and supplies. We are continuing to monitor that. The operational response is actually, our workload is increased, in fact, because when we have webinars with varying time zones, we have to adapt to our needs of the countries. So we cover webinars with more participants. And what WHO has also done is to have what is called Open WHO, where you can see several training packages. And these leads, they are at the end of the training, it's free. And at the end of the training, you do get a certificate. And what we have also done as part of the normative guidance, as you can see, one of this document, we have been partnering with other agencies on community-based healthcare during the COVID pandemic. There are several documents there which have been which are available on WHO website on implementing NTDs, which started in 1st April 2020. Then I showed you the document with UNICEF and IFRC, and then we have a recent one on maintaining health services during COVID. And there's a more recent one which is coming in the World Epidemiology Report. So moving on, we should emphasize the fact that we must remember the global vector control response, and this is something which is top of our mind. We are committed to this targets, and many countries have been working on it. The overall goal is to reduce mortality during this period by at least 75%, and we are frankly on course. About 9% reduction has been noted in reduction in mortality of vector-borne diseases, but at the same time, it is many of the activities are affected due to COVID. But I just put this slide mainly to remind ourselves of what our key goals are. Essentially, the global vector control response and its commitment to it, to highlight the integrated nature of vector control, is very important. So we are in the midst of a pandemic now. Are we going to forget these diseases? Certainly not. As you can see, we are bombarded with these information on the media, where actually we are tracking dengue, being a focal point in dengue. We have been tracking it regularly, and as of today, 1.2 million dengue cases have been reported in countries in 2021. 2020 also there were cases in many countries, and today there is co-infection of dengue and COVID, a challenge which many countries are adjusting to. They have developed the necessary guidelines for it, and then at the same time we have outbreak of chikungunya in a country. We have outbreak of Zika occurring, and surprisingly, as you can see, the last one, there is a dengue and Zika in India, which is a bit of an alarm, and more investigations are currently ongoing. So just to touch on various arboviruses, chikungunya in 2020, we had around 200,000 cases, mostly in South American region. But as you can see, India as well as Chad was affected. It was also reported in 2021. We still continue to record chikungunya in several countries. The same applies to Zika. There were 20,000 cases in 2020. And as I said earlier, this year in particular, it's a bit alarming. More countries are reporting Zika, and the one in Indian subcontinent, India, is a little concerning because being a densely populated country, we hope this is manageable. This number is fast rising. And dengue, as I said, we are just recovering from a worst dengue period of 2019, where over 100 countries were affected, and we recorded the highest number of dengue cases in countries. So 2019 was a very bad year, but as I said earlier, 2020 and 2021, we are still recording many cases of dengue, and this recording may not be even accurate because several of our staff have been pulled for COVID duties. So how reliable are the diagnostics and recording systems in countries? We are still assessing the impact. Now, as you can see this map, these three diseases are basically one of the top priorities right now. When we overlay them, almost 129 countries are affected. Dengue alone affects 129 countries. And then you have chikungunya and Zika. If you overlay one over the other, the more darker the countries are. So coming to dengue in particular, dengue, as you know, and COVID are both viral diseases. And at early stages of infection, it is very difficult to differentiate them. There are some confusion in the clinical signs and symptoms of this. So the laboratory features leads to misdiagnosis and can complicate case management. There are false positive dengue, which also been triggered during this period. Dengue deaths have been reported because patients are not able to reach the hospital, and there are no hospital beds really in the worst scenario where COVID is affecting countries. So almost 100% of the hospital beds are given to COVID patients, and dengue patients, there are instances, have died due to that. Efforts are really being made to strengthen capacity and accurately diagnose and manage both the diseases. So what we are also trying to do is to heighten the awareness among communities, basically to prevent exposure to vectors, and a significant number, and it is also possible that a significant number of asymptomatic dengue cases, for example, with very little test facilities, may be moving around undetected and helping in the mosquitoes to pick the infection and trigger transmission, mainly in urban pockets. So we also have what we have done in WHO is to emphasize the importance to sustain efforts to prevent, detect, and treat vector-borne diseases during this pandemic. Malaria has achieved significantly here because they are trying their very best to sustain the malaria intervention, to keep up their interventions on track, but there is still disruptions there. And so a lot of effort is being put, and we hope a similar effort can be adopted to control dengue and arboviruses, especially in urban pockets, because these diseases affects the urban area. And as you already know, almost 60% of the world population is in urban pockets. And once a disease transmission begins, it can be alarming. So dengue prevention control methods to lower the mosquito density before monsoon, we had emphasized a lot. A significant amount of effort was made at country level, especially to prevent the peak of the transmission. And what we are trying to do is to encourage households, even during lockdown. For example, households can go around their homes and prevent vector breeding. So if you just check in and around your house once a week is enough for half an hour as a family exercise to clean all the garbage which can accumulate water, prevent breeding, it would contribute significantly. So we are also encouraging our vector control workers to use the protective clothing in case they are going out to the field, maintain the social distancing norms as per the COVID protocol, and we are encouraging the use of insecticide repellents and bed nets if you are sleeping during the daytime, and especially for elderly, pregnant women and children. Intersectoral coordination is very important, and those who are countries where we are able to implement some measures, larviciding, targeted spraying are being carried out in few pockets where dengue picks up soon after monsoon. And the goal is really to reduce mosquito breeding sites, and this opportunity, especially when there is a situation when we are working more from home, gives an opportunity to rearrange our schedule and make sure that your environment is free from mosquitoes, and cleaning up helps as a group exercise. We are also falling back. As I said, many staff have been drawn to COVID duty. So where do we go? We depend a lot on community health workers. And many countries have tapped their community health workers to do joint campaigns for both COVID and dengue. So simple informations, IEC materials are being given to these workers on both the diseases. We are encouraging communities to prevent mosquito breeding, and in schools, wherever they have started, or we are trying to see whether it is possible to talk about, they of course address COVID in schools right now by distancing children, washing their hands, as well as wearing masks, but we are also trying to push the concept of mosquito prevention within schools, but again, following COVID protocols very strictly. Before I move on further, I just wanted to touch on a special topic which is taking shape in our organization right now, and this is a global response to arbovirus. We call it WHO's Global Arbovirus Initiative. I just want to briefly touch on this because we really do not want, we must remember before COVID, the previous outbreak, or which was of public health importance, was Zika. And we really don't want such a scenario to come again. So we really want to be prepared for any potential outbreak of probably a vector-borne disease, and that too in an urban pocket. So this initiative is a cross-cutting initiative within WHO, an integrated approach to strengthen detection, prevention, response, and control. Right now, we are targeting on Aedes-borne diseases because they are really hitting urban pockets and large number of people. We are also advancing innovations. There is advancements of innovations in vector control, vaccine development, diagnostics, etc., and the clinical care of all the 4 diseases, chikungunya, dengue, yellow fever in parts of Africa, and Zika. We are harmonizing most of them. We are, as I said earlier, empowering communities to support surveillance and prevention, basically, and wherever possible to put in place sustainable vector control measures. So we also want to, this initiative is yet to be launched, and I'm really sharing it with you because please join in, because there's a call to really contribute to this initiative with your thoughts and ideas, and those are most welcome. And we really we hope this initiative will get launched sometime early next year, but a lot of groundwork is ongoing right now. We want to raise the alarms on vector-borne diseases. We want to work across the health sector, agriculture, urban administration, environmental sector, etc., and enable optimum use of limited resources. We know that resources will be, again, in short supply as we move forward. So this integrated arbovirus strategy has nearly 6 pillars, but these are, again, we are still in the draft stage. We are under consultation, global consultation and expert consultation, which will lead to further refinement. So there are the key pillars are monitoring risk and anticipate outbreaks, reduce epidemic risk, strengthen vector control, prevent and prepare for pandemics, build a coalition of partners, and enhance innovation and new approaches. So these are the key pillars of the strategy at the moment, but there can be changes as the document gets further refined after extensive consultation. So basically, where do we go? We are not going to go to status quo of pre-COVID days. Certainly, the world has changed, and we need to adapt for the future. So really, we have to look at robust integrated surveillance with both private sector and public sector working together. Role of data and decision making has to be highlighted. PCR-based, something which I will touch on in the next slide. We can implement multi-sectoral healthcare and health prevention, where a lot of trust, confidential reporting, monitoring and evaluation can be done together. There is a need for effective coordination, leadership, and of course, financial support. Shared resources, especially workers. As I said, we are falling back on community health workers and other allied fields who can help in vector control. Preventive services should be result-based, and that's going to be the norm from now on, because we need to produce results if we want to sustain our program. And in a devolved system, we encourage national, regional, and provincial resources to be harmonized, and above all, a much greater community ownership, community participation, with media playing a greater role. So NTD and COVID, basically we must look at, though we are in the midst of the pandemic, we have to look at what happens after this. So the essential key message is we have to adapt and innovate. Programs have to adapt and build on new opportunities. For example, the COVID has really opened the field to large number of RT-PCR centers in almost all countries. We need to utilize these centers to build on arbovirus diagnosis, based again on RT-PCR. It's just a question of changing reagents, and we will have this infrastructure and facility which we need to utilize. The One Health approach and working with other partners is definitely a way forward, and there's a lot of work being done. The webinars have opened up a new vista of opportunity of meeting people. Even within an office, for example, you may have 20 field stations. You have an opportunity now. You don't need to meet face-to-face or take a phone. You can talk over each other. Webinars have really opened an opportunity of close meeting, regular meetings, and short consultations, which helps them to strengthen their technical skills as we move forward. The second thing is to integrate and collaborate. Delivery of preventive health service, we have to work together. Urban health is a huge topic which is gathering momentum, and you will hear a lot more about it. And we need to have sustainable vector control solutions there. Sustaining the collaboration, pooled resources for better reporting, and utilization of the lessons learned right now during COVID would be very useful, because there's a lot of work done during this COVID times where many of the lessons learned can be easily adapted and sustained. And of course, our prime focus is the countries, pushing forward, resetting targets if needed, catching up campaigns, preventing, and we really need to look at ways to prevent any future epidemic. And this is something we are working very closely with countries. So there's a lot of parallel activities going on with member countries. We have priority countries, we have other lot of work going through, and it's really work-wise, our load has increased, but at the same time, we are in a different world, working in a different environment. And I think once there is a ease in travel, we will get back to some level of normalcy, but at the same time, the work is it's a different mode of work, which we will be doing in future. And these key points are basically new opportunities for us as we move forward. I think I stop there. Thank you very much again for giving me this opportunity.
Thank you very, very much, Raman, for that. A round of applause for that virtual round of applause. Wonderful scene setting, and I love the kind of fact that it's opportunities. You're using the word opportunities, very positive outlook based upon this collaborative kind of mindset and kind of pooling of resources and bringing people together. You mentioned quite a lot of interesting things there in terms of your presentation. Obviously, dengue is a huge thing for us. We're kind of campaigning for a World Dengue Day. We've been quite active in that, putting together various disciplines in that, and that's all on our website to have a look at. Thank you very, very much for that. I think there's been a lot of interest in that particular presentation by the audience that have been assembled. Just a quick shout out there for a second. We've got Dr. Parim Kadriaj from Albania joining us, entomologist, Dr. Mohammed Ajmal Khan, who I met actually in Pakistan, a medical entomologist. Thank you. I'm surprised you're here, probably still celebrating the cricket result from yesterday, so good to see you there. Dr. Monica Hernandez Estrada, entomologist from the University of Neuchâtel, Arti Prasad from India, Anatol Miranda from Uganda, an entomologist. Paraprim is from the Institute of Public Health in Tirana in Albania. Interesting public health going together with vector control, so that's great. Ronald Morales Vargas from the Ahmed Ol University in Thailand. From Mexico, we've got Dr. Daniel Velayudhan. From Kenya, Collins Onditi. We've got a lot of geographical reach. I think it illustrates something you said earlier, Raman, in terms of these webinars and open kind of source adaptation when it comes to this COVID response. I think that we've definitely done that since a year and a half now. We launched this Connect series, which a lot of people would probably hopefully be familiar with. It's all there for everybody to have a look at. And we felt it really answered the access question from the old days, which we can barely remember now, physical meetings, where it'd be an absolute disaster trying to get somebody to come in with visa constraints and flight costs and accommodation costs. This has really opened that era, I think, a new era of open source, that kind of progressiveness when it comes to these meetings and the way we're all working. And I think that's a great dot into Frederik, Dr. Frederik Seelig's effort at the Global Vector Hub, in terms of an amazing open access effort that you've put together at the base, predominantly the London School of Hygiene and Tropical Medicine. I know in July, Frederik, that you guys had put together a workshop looking at the impact of COVID-19 on global vector efforts. I think we're going to put the link up in our chat box as well for the audience. If they didn't see that, they can see that. The link to that, I think, will be going up shortly. So, I mean, we wanted to kind of balance this the panel out. Raman, it's always a pleasure to have you kind of set the scene and really show that leadership in terms of the directions. For us, it's a very positive direction in terms of the kind of things that you've highlighted there. You mentioned the new opportunities, integration, collaboration, and then underpinning that, sustained collaboration by pooled resources. I think that's a really good segue into the Global Vector Hub's efforts. So, I mean, without further ado or further from me, I think we'll hand the floor over to Frederik. Following Frederik's talk, there will be a Q&A, and I think you've seen we had some questions coming through. This is all about you. This is a community effort. It's open for a reason. It's we've opened the access to this, this meeting for a reason. We want that interaction and that immersiveness from the audience with the panel. So please go ahead and get your questions together. We will be having a Q&A after this. Enough from me. I think over to you, Frederik.
Brilliant. Thank you very much, Raman, Kamran. And again, thank you for giving me the opportunity for presenting here today. I know it's always a hard act to follow up Raman and his really impressive presentations, but I'll try my best. So yes, you can see my slides here. The title is "The COVID-19 Pandemic Should Not Derail Global Vector Control Efforts." And this is also the title of a Viewpoint article that we published last summer in PLOS NTDs. And I'll come to that in a moment. Perhaps first, just a very quick introduction on the Global Vector Hub. The aim of this online platform is that we will become instrumental in the elimination of vector-borne diseases worldwide. And the aim is to bring together researchers and vector workers on a very large scale and cutting across disciplines, different diseases and different vectors. We did launch an early version of the Global Vector Hub last summer to allow for access to key information during the pandemic. And this has been quite successful. So you can already look it up on this link shown here, and you can also register. And then a fully functional version is about to be launched in the coming weeks. So please bear with us for a few more weeks. This full version will include additional data features, much improved access to resources and networking features. And really the overarching aim is to focus on capacity building and system strengthening for vector control globally. And we aim to establish a global community of practice for vector control interventions. Since January, it also includes a global directory of training courses in medical entomology, which has been developed between the Global Vector Hub team and ArcTech and TDR group. And I'll come to that in a moment as well. So as I said, we launched this in January of this year and has been developed together with TDR and ArcTech. This really aims to strengthen capacity for scientists fighting neglected tropical diseases and other vector-borne diseases. At the moment, the registry features 126 different training courses from 32 different countries. So again, I would encourage everyone to have a look on our website. You would need to very quickly register yourself, and then you can access the entire directory. And please do get in touch if you have any feedback or any suggestions on this. So again, looping a bit back to what Raman had already described, vector-borne diseases during the COVID-19 pandemic. There were some really encouraging signs, particularly in view of malaria. The rollback malaria report last October described that malaria campaigns were still on track in the most of the affected countries, despite the pandemic of COVID-19, and especially the distribution of bed nets and other interventions. And of course, there were some really impressive successes when this summer China could be certified malaria-free by the WHO, and I think this is really quite an impressive milestone. However, on the other hand, we do have other vector-borne diseases, and I see this as really almost like a copy of Raman's slide. So we do have numerous outbreaks of dengue, particularly across the globe. So we have an epidemic in dengue, in Peru, but also in India and elsewhere. We have outbreaks of chikungunya, of yellow fever, and some of these are really compounded by the COVID-19 pandemic. For instance, that people are very hesitant to get tested for malaria or for other vector-borne diseases because they're afraid of catching COVID in a health center. And as Raman had already described, there are also very much reduced capacity in terms of community health workers, in terms of vector control efforts. And I will describe it a little bit more in a sec, how we assess this from the global community. But still to continue with dengue. So these are the data for South America, and as you can see here, 2019 and 2020 were really significant epidemic years in South America, with a majority of the cases in the southern cone, so Argentina, Brazil, Chile, Paraguay, and Uruguay, and they always peak in the first half of the year. So as you can see, while the figures for 21 are a little bit improved, it's still an ongoing cause of concern, particularly for health systems that have already been weakened by the pandemic. So as I said, this is the Viewpoint article that we published in response to the COVID-19 pandemic. A broad coalition of global vector experts, both from LSHDM, but also international partners from the CDC, from the Pan American Health Organization, the Inter-American Institute for Global Change, Durham University, and the Malaria Consortium. So really broad coalition, and we really emphasized the calls for continued vector control efforts while maintaining protection of the vector control staff, improved communication, improved funding for vector control efforts, and also improved exchange and flow of data in an open access manner. So again, very many of these suggestions overlap or are similar to those made by WHO and other institutions. We also hosted an online workshop that Kamran had mentioned a moment ago. Actually, it was in July 2020, where we discussed the impact of COVID-19 on the global vector control efforts. So we had an amazing panel. So we had Raman from WHO as a panelist, our own director, Professor James Logan from LSHDM. We had Dr. Damaris Matoke-Muhia from PAMCA in Kenya, and we had Dr. Grayson Brown from the Puerto Rico Vector Control Unit. So we really managed to assemble a global panel to assess the impact in different regions and different settings. You can see the recording. You can access it live through the Global Health Network, with whom we've partnered for delivering this workshop. And just to summarize some of the findings from this workshop, because I think this is really still valid in many points. So first of all, highlighting the negative effects of the pandemic, and particularly sort of preventative measures, colloquially known as lockdown. So for instance, there was a distinct lack of funding and a diversion of resources and of staff due to COVID. Perhaps more generally, an overarching lack of knowledge within the community of vector-borne diseases. So really, there is this need to raise awareness of how vector-borne diseases are transmitted. The risk of patients being stigmatized. Routine operations such as vector surveillance had to be postponed. Same for vector control operations that would normally work on larval control or mosquito control. So for instance, treating breeding sites, especially in urban areas. So again, really crucial for controlling Aedes vectors. And also the lack of media interest for any topic that is not related to COVID-19. So it's been really a challenge to reach out and to highlight the risk of these other ongoing vector-borne diseases, sometimes of epidemic proportions. And again, ongoing challenges of accurate diagnostics, case management in primary healthcare, and how to treat dengue patients. So all these are points that Raman had also mentioned already. However, there were also some really positive outcomes and lessons that were realized during this workshop. So really continue or increase the use of community health workers with adequate protection. Highlight again the availability of online training to increase and improve surveillance capacities, but also capacity building and sort of more generally in training. Encourage entomological surveillance in quarantine centers, so for instance, migrant workers returning home, and really highlight the community and family engagement of vector control efforts. So emphasize house cleaning, rubbish removal, and really placing greater emphasis on prevention of vector-borne diseases. And more generally speaking, the need to really build capacities using outreach activities and enrolling external partners really in a broad coalition. So again, this highlights the challenges, and this is something I'll come back to in a moment, is really the need for clear communication. Really need to emphasize that not all diseases at the moment are COVID-19. We need to preserve the gains made in vector-borne disease control and strengthen the coverage, and really empower county-level communities to address the challenges for vector control. So, for instance, targeting breeding sites, and really empower community health workers by providing them with resources and with training, empowering women, minorities, and improve also communication among stakeholders and breaking down silos. Again, local level capacity needs to be strengthened for vector control and vector surveillance. So this is particularly important for tracking moving vectors. So, for instance, vectors of West Nile virus in India, or currently Anopheles stevens are emerging in the Horn of Africa region, and really being adaptable, being able to target hotspots. So integrating both epidemiology and entomology to track down local outbreaks, both relevant for dengue, but also yellow fever, which is something we are currently looking at. And really also being willing to learn from positive experiences. So include the private sector and really be open for any sort of collaboration that could be beneficial. And again, as Raman had described, the GVCR 2017-2030 strategy document really emphasizes all of these recommendations. So it should be really recommended to integrate this strategy into national planning. We also ran a survey among the sort of global community that we access and serve through the Global Vector Hub, again, to assess how different sectors and stakeholder groups are affected, what control and surveillance of which vector-borne diseases are most strongly affected, identify gaps in knowledge and communication, and also develop robust recommendations for future epidemic preparedness. So this report is also available on the website of the Global Vector Hub. We managed to reach a wide range of respondents from 47 different countries. And as you can see, really quite widely spread geographically. However, the vast majority of the respondents were from North America, interestingly. So there might be a slight bias in the responses to diseases and the situation in North America. So main background of the respondents was in vector control, public health, but also epidemiology and other areas of science. And a large proportion of the respondents really reported a severe impact on their own work, and about 55% felt that COVID affected vector-borne disease research and control operations greatly or extremely, and another third at least moderately. So as you can see, the impact is definitely being felt across the spectrum. And the main points really highlighted here was sort of the availability of staff, the lack of travel and transportation facilities, lack of access to resources, a lack of funding, field sampling that was interrupted, access to facilities was impeded, that researchers were unable to test patients or even to treat them. So all of these were described as negative factors. Furthermore, accurate and up-to-date entomological and epidemiological knowledge surveillance data were highlighted as lacking. Guidance for COVID mitigation during vector surveillance and vice versa. People were unsure where and how to obtain such information, but also it wasn't clear how COVID-19 interacts with specific vector-borne diseases. Lack of training activities. I mean, some of these really have to be done in a physical manner, so because of distancing measures, these could not be carried out. Fake news, the wave of misconceptions and misinformation in the general population is really a cause of concern, but also very often a lack of clear government guidelines and accurate information was identified as a severe shortcoming. So the main vector-borne disease identified being impacted on by the pandemic were malaria, and then a lot of arboviral diseases, so dengue, chikungunya, Zika, and also Lyme disease. And I guess this highlights also the focus on North America by a large part of the audience. Moving on from then, however, we do have some very encouraging new tools that we are hoping to be able to on a global scale to deploy against vector-borne diseases. So obviously this year the large-scale clinical trials showed high effectiveness of Wolbachia-infected mosquitoes for controlling dengue in Indonesia, so really promising results there. Targeted indoor residual spraying really is able to reduce dengue transmission, improve communication also on Rift Valley fever and other neglected One Health vector-borne diseases. And of course, vaccines, especially now in the context of the COVID-19 pandemic, this is on everyone's mind. And we just had the groundbreaking recommendation to recommend by the WHO to recommend the malaria vaccine for children at risk. And this is something that really has been hailed as a milestone. Despite the not amazing effectiveness of the vaccine, but even so, it's promising to have an amazing impact on malaria transmission, particularly when combined with other already existing interventions. The same goes also for other vector-borne diseases. So the French company Valneva just issued this press release that they had very promising phase 3 results for a single-shot vaccine candidate against chikungunya. So really highlighting a very successful results there, and they're expecting the final trial results within the next few months. So fingers crossed that this is another disease that would be another tool to fight vector-borne diseases more effectively. So really, in terms of the future outlook, we should really make it clear that health authorities should provide clear and evidence-based guidelines that are really especially adapted to local circumstances on how to conduct vector surveillance and control operations in a safe manner. And this is really core to the global funding community, provide increased funds for capacity building and epidemic preparedness, including comprehensive preparedness planning, increased training, and also strategic reserves of resources, because this is also something that became very evident during the pandemic, that some things simply ran out, be that protective equipment or lab equipment. So really build some strategic stocks. As I said, strengthen local capacities and empower community health workers, support collaboration among stakeholders and break down silos. Adhere to sort of a One Health approach. I think this is something that really needs to be emphasized. New tools such as Wolbachia and vaccines and digital tools that have been shown to be effective should be supported. And any changes in policy and practice should really be based on evidence generated by the vector community and thus leading to improved preparedness against future outbreaks. However, and then I shouldn't close without mentioning climate change, I guess, because this is at the moment in the run-up to the COP26 meeting in Glasgow on everyone's mind. So I just wanted to highlight here this recently published study by our colleagues from LSHTM, by Rachel Lowe and Filippo Colon, really that the risk of global warming for malaria and dengue especially, which might affect billions more people if global warming continues uncurbed. And with that, I'd like to thank my colleagues at ArcTech and the Global Vector Hub team for their stellar work. And I would like to invite you all to follow us on Twitter if you're not doing already. If you have any data sets or if you'd like to register, please do so by following this link. And if you have any questions, please do get in touch. With that, I'd like to thank our funders and our colleagues, and thank you all for your attention. Thank you very much.
Thank you very, very much, Frederik, there for a magnificent presentation on such an amazing approach and such a needed approach, the Global Vector Hub. So much to unpack in all of those, in both presentations. You've heard two call to arms there. So anybody interested in getting data sets across and getting involved with the GVH, you've seen that from Frederik. And then from Raman, we had a call to arms for the embryonic kind of arbovirus initiative, which sounds very, very exciting, I must say. I know there's a yellow fever meeting on, I think it just finished or it's just on, so very topical as well to bring all of that in. So the call to arms are out there. Thank you very, very much for some really inspiring points. Frankly, leadership position on both presentations in terms of the global community. So that's very much appreciated. A lot of people are saying that in the chat as well. Very impressive presentations, and very happy to see that. We've been joined by a few other people. So just a quick shout out to some of the audience again. So one of the PhD students from the University of Sands, Malaysia. He's actually from the Federal College of Education from the Yobe State in Nigeria, but he's studying in the University of Sands, Malaysia, Amadou Bokar. Delighted to say Justin McBeath, the global lead for vector control for Bayer, has joined us. So hi there, Justin. Dr. Hamidi Barthélemy from France, I believe, is here. Dr. Elton Rogozi, one of the heads at the vector control unit at the Institute of Public Health in Albania. He's saying it's so good for this meeting, and we need to strengthen the need for vector control management. So that's great. We've also been joined by quite a few people from across the world. I'm just scrolling all through there. Rafiul Raman from Pakistan has joined us. He was at Fiocruz for his PhD. John Invest has joined us. He's asking, will these presentations be available on YouTube? Yes, they will. We'll be editing and putting those out. So that's good. We have a Q&A in mind. I mean, time is running short, but we can go, if everybody's okay, we can just kind of get a couple of questions in. We've had some questions coming in through from the audience, which I'll come to in a second. One of the kind of things we wanted to circle in on is community. Really, you both mentioned that in your presentations, and it's obviously very, very important. In terms of the community, raising awareness for transmission of VBDs, just raising that kind of level of understanding in terms of how the disease is going to spread within the communities, and then preventative measures that the community can engage with and do. Given that, and then given this drive for multi-sectorial kind of move from the rhetoric to actual practical reality, how does that affect entomology and the way it's taught? I want to ask that to Raman first, because I remember having this mad conversation with you in Geneva several years ago about how entomology needs to be brought into schooling at a very early age, perhaps. You know, how do you see that now in light of COVID? What are your views on that in terms of raising awareness, educating the lay community to then get them to engage ultimately with vector control activities all the way to surveillance, you know, in terms of mosquito vector surveillance? How do you do that, Raman? What would be your ideal situation?
Well, thank you. Yeah, this is an interesting topic. Basically, this has to be done at several levels, and it's not a one-off shot. So if we are targeting schools, school children, we have to make the subject itself as simple and clear as possible. So interestingly, when you talk to school children and you just even describe a simple life cycle of a mosquito, they are completely thrilled. They just don't know how this creature is. And even beyond mosquito, to be honest, we can expand to entomology, like a life of a bee, for example. It's a fascinating life. One of the best creatures in the world is a bee, honeybee, which is highly evolved. They have a division of labor, they have a township. So all these excites children, and these are things we really need to inculcate in them today, and especially with all these climatic changes and damages that is being done on life itself, especially for insects. For example, in Europe, almost in Switzerland, there are 70% drop in honeybees, and it's a significant impact on all agricultural sector as well as the honey production, etc. So this needs to be built, and children needs to appreciate this as a beneficial creature. Of course, mosquito is an annoying one, and and then once we bring in that, the issue also is, say 50 years back, these diseases were unheard of. Dengue was there only in 7 countries. Today it is there in 129 countries. So what mistake did we do to bring dengue at our back door? And that is mainly because our surveillance were absolutely bad. We were not watching where the insects were spreading. Secondly, our sanitation systems have failed, and garbage and all of we have been accumulating more and more garbage as we move forward. So all these things, once we think carefully and if we can inculcate that in children and even among targeted household members like women's group, church group, then we can have a real lively debate with them, and also make sure that some of these activities are implemented on a routine way. One lesson we really, some of us take back is from the EPI program. The immunization program have been advertising the vaccines for children so aggressively in many ways, to such an extent now the mother remembers the dates so well that she gets fully prepared to take the child to the clinic on that particular day. Now, what did they do to achieve that? We really need something like that to come in as a part of habits. And this is something which is feasible. With the least impact, we can control vectors. We can keep them at a low level so that transmission is kept low. And basically, we are moving towards just not talking of Aedes or Anopheles. We are talking of all insects. We have to keep them at a manageable level, and we have kept it for centuries. So why are these crises? The crisis is mainly because of mismanagement from our end, and we have to rectify that as we move forward. I'll stop there.
So, I mean, that's brilliant. So I suppose what you're saying is proper definition of the communities and get in there early, basically, and bring these people in on that life journey, so they're aware of these issues and they are then positively engaged with entomology per se. Frederik, I'd like to ask your opinion on that, because I know you're gathering data. We love the interface. I think it's the beta version you put. I think that the globe with all the new. I think that's fantastic. It's so alive. It's brilliant. What you mentioned, communication as one of the challenges within the kind of your presentation. Slightly, what would your view be on that? What do we need to do? Is it all just about evidence base, and is it all just about those kind of numbers and that, or what else do we need to do? What other kind of modality do we need to bring in?
Thanks, and thanks again for the praise for the global vector layout. I can't claim much credit for that. First of all, I should also declare a strong bias. As a medical entomologist, I'm obviously convinced that mosquitoes and other insects within this group are really fascinating. So I'm not a neutral observer here. But I agree. I think you need to really catch them early, that is children, and really when they have this amazing ability to get fascinated by nature, by what's around them. And I think it worked for me. So really this is something that should be really be emphasized and be included in national curricula. But I'm also sure there's a lot of advocacy and groundwork required to really make sure that the authorities are really on board with that. But as you just said, it's not just about the facts and the evidence-based. I think this is really key for making any decisions on public health and veterinary health interventions. But really for the general public, I think you also need to combine it with some really captivating stories, really having a really good narrative that captures the attention and really, I mean, obviously all the time being accurate, but also in an engaging manner. So some examples I could think of, our colleagues at Arctech, they have been really doing some very nice outreach work on public health and on hand washing, really producing some children's book cartoons for primary school children. So really something very useful. And the other example, obviously in a more vector-based context, is I think the work that the World Mosquito Program has been doing in engaging with the communities where they have their large-scale releases. And I believe also Oxitec is also doing the same. So really encouraging reaching out to school children and making children aware of the of the challenges, and then moving on from there. And perhaps then also at the other end, when, let's say, students have been exposed to medical entomology throughout their school career, then they should also be offered opportunities to work in this field. So really, by increasing capacity and providing additional funding, offering more jobs in these fields, and opportunities to study, of course, but also really to work as an entomologist, as a vector control agent in your local community, for instance.
Yeah, that's a great answer. I know we're very familiar with Professor James Logan's outreach at Oxitec.
Arctec.
Fantastic work. Yeah, Arctec, sorry. We were very, very familiar with that in that sense, because we've seen that. I think it's absolutely vital. I wonder how, you mentioned COP26. You mentioned Rachel Lowe in terms of one of your co-collaborators on that huge paper. Obviously, Dr. Rachel Lowe is on our dengue advisory group as well, and a very active member, actually, just as you are. I wonder if COP26 is that touchstone. We're going to be there ourselves, actually. We've got a side meeting planned. We haven't put the Marcom out for that. We were going to towards the end of this week, but we're going to be there looking at a couple of things, dengue related, actually, for that. But is that the touchstone of the new generation of young people who are very committed to climate change activism, or that kind of mode of thinking? Can entomology be brought into that equation for them? Is this a perfect opportunity to up the ante for outreach? And if so, who needs to do it? Who should be doing it? The London School, the WHO? We've got private sector here. Is it a private sector? We need them involved. What do we need to do? I mean, is COP26 that touchstone that we need to ignite? Because I think entomology right now, everyone's talking about diseases. Everybody's suddenly become a public health expert because of COVID. The timing is right to link the threat to not getting VBDs right, or the control and prevention efforts. Entomology is right in the zone. Is this the time to kind of align ourselves with the COP26 movement and move in that direction? I'll ask Raman first. I mean, and then we'll come to.
Thank you. I think your question is absolutely relevant here. Yes, it is. It's a time, but our challenge here is, it falls back on us. How do we package this well? And this is a key point, which probably Frederik would be able to help us also. We need to package this to politicians, to the decision makers in a very effective way. Yeah. We do not find a space of even a paragraph in many of these COP documents, but we are trying our very best to enter there. And the WHO document at least mentions the threat of vector-borne diseases and mentions dengue. Yes, so malaria, everything could increase if the temperature warms up. So all these information is there, but the question is, how do we package this? And this has to be packaged with the caveat that this could be the next pandemic, to be honest. And if a steep increase in temperature could trigger an outbreak of a disease, X we call it in WHO, which is transmitted by a vector, like what Zika did, we would be in deep trouble. And we really don't know which mosquito would do it. There is not only Aedes. Aedes is a very efficient vector, but there are Quillex-borne diseases. There is tick-borne diseases picking up. So these are at the back fast, and ticks are migrating, to be honest. And there are several publications which show that warm temperature favors them enormously. So the threat is large. The question is, how do we package it, especially with the COP audience? Over to you.
Yeah. That's a great point. The communication has to be just right. Frederik, you've mentioned climate change. Are you going to bring some of that into the tool, into the hub?
Yes. I think it's would be very, very silly to not to include it. Ourselves, we don't have that much expertise in really climate change work at the moment. However, we're planning to expand and collaborate further with our colleagues, especially at the other centers at the London School. And I also agree that COP26 would be really amazing opportunity. Obviously, the question is how do you get through, because everyone else will also be clamoring for attention.
Yeah.
So I think we need to, as Raman said, have to have really clear messaging, highlighting the threat of vector-borne diseases on a global scale if global warming continues to increase, and really need to be sure that we have to be relentless. Essentially, we have to be really focused and make sure that everyone gets the message. And if not now, there's never a better time than to act than now. And I think we have to be really proactive and really go out and try to reach as many people as possible. Thanks.
No, that's a great answer. We ourselves will have that side meeting. We have 2 panels we're putting together, looking at that at COP26, but as a side meeting, and we'll be releasing some of that at the end of this week. So we'll let you know what we're doing with that, and we'll bear all of that in mind. I've been asked that we're going to have to call a stop because the next session is apparently starting at 10:45, and we've just got to run through some prelims with them. Had longer. There's so much to unpack in all of your work and everything that we're doing. There might be some slight transmission issue in terms of I'm not sure what it is, but one of the audience is asking, I'm not sure, some in and out in terms of the sound. I'm not sure what it is, but we'll have a look at what's going on. I'd just like to say thank you very, very much to both of you for a very early start. And we really appreciate you setting the scene with your presentations. People can contact you directly on the links that you put forward for the Arbovirus initiative for Raman and for the data share and the kind of getting involved more with the Global Vector Hub effort. So, that's all there for the audience. The audience saying thank you as well. There's never enough time. There's never enough time to say goodbye properly, and it always seems so abrupt. But thank you very, very much, both of you, for that. And for all the audience that are watching, we'll be moving to our next session shortly in about 5-10 minutes from now, looking at one of those kind of issues, disease surveillance, looking at how that links all the way to vector control policy and the changing of that. Whether that's through a tech approach, and you mentioned other mosquitoes. We were looking at the new Anopheles stephensi paper by Dr. Ayman Ahmed coming out in the next session. So thank you very, very much. A round of applause to yourselves and the lovely audience as well. Take care, keep safe, and until next time. Okay.
Thank you.
Thanks a lot.
Bye-bye.
Bye-bye.